Right, 43 deaths and just over 1,300 COVID-19 cases. These are the latest figures in KwaZulu-Natal. ENCA reporter Siphamandla Goge attended that earlier press briefing by KZN Premier Sihle Zikalala. Siphamandla, notably the numbers coming out of that province, but some other information about key hotspots in the province were mentioned, but no numbers specifically for those districts. Which districts and hotspots are leading in KZN?
eThekwini, which is the provincial economic hub, is the epicenter, and you would have Ilembe district, which comprises of areas such as Palito, Stenga, which is Guaduguza, Mandeni, Esho, where it's on the north coast of the province, and you would go to the Midlands, the provincial capital, which is Pietermaritzburg. So currently those are the three districts that are troublesome in the province of KwaZulu-Natal. So Provincial Premier Sihle Zikalala articulating when it comes to the issue of the PPE. Our viewers would recall that there was an intense debate about that. Some unions threatened to go to court saying medical personnel and staff have not been provided with adequate PPE, but the Premier of the province said they've got enough stock, but they are preparing for the worst. So in a way, he says even though they've got this stock available, but they are planning and preparing for the worst. Let's listen to him.
Informed by the current patient load, we have adequate PPEs in stock. We are, however, preparing for a worst-case scenario. And therefore, in terms of the personal protection equipment, we can safely say that we are at a stage where we have enough stock, but we also continue working to increase, given the fact that we would want to be ready for any eventuality as we go forward.
Siphamandla, the Premier said quite early on in his briefing that community screening and testing has helped the province to proactively identify more cases instead of just relying on contact tracing from existing cases. But many experts countrywide say that testing is still insufficient. Has the province laid out any plans to work on the backlog of testing results and ramping up more testing across communities?
Indeed, they say they will continue with testing, but mass screening, they say, is equally important. Our viewers would recall that they launched their mass screening and testing in Pietermaritzburg, Umgungundlovu district in Kwajigajo informal settlements. At the time, Umgungundlovu was the second biggest district in the province, contributing with the highest number after eThekwini. So they are saying, yes, they need to do more testing, but mass screening as well is important because it gives a picture in a way of how the situation looks like. But what is equally important is ensuring that they are trying to catch up with that backlog when it comes to the issue of testing, because KwaZulu-Natal accounts for about 15% of all the cases in South Africa. It follows the Western Cape and Gauteng. So that is a concern to the provincial authorities. But Sihle Zikalala explains the breakdown of all the figures and statistics in the province. Listen to him.
The total number of people tested positive with the COVID-19 as of the 9th May 2020 stand at 1,307. A total of 608 have recovered. 656 are active cases, and then 43 have sadly passed away, and may their soul rest in peace. The number of new patients reported in the province is 19 on daily basis, with eThekwini and Ilembe district contributing the highest number of cases daily. There are 54 new cases that were reported in the province just yesterday alone. So in a normal situation, when the numbers are low, daily there will be around 19, but the majority come from eThekwini and Ilembe. As of the 9th of May 2020, The province had a total of 135 hospitalized patients, 46 admitted in private sector and 92 in the public sector. There were 13 patients that needed to be taken into intensive care units.
Siphamandla, last question for you. A key issue in the province has been the closing and reopening of hospitals. Both the St. Augustine's and Kingsway hospitals were reopened today. However, another hospital in the KwaZulu-Natal area was closed, and that was the Justice G. Mpanza Hospital. Tell us a little bit more about what Health MEC Nomagugu Simelane Zulu had to say about hospitals.
So that hospital is a public hospital in KwaDukuza, the General KZN Mpanza. It was closed following the confirmation of 16 positive COVID-19 cases. But let me tell you and our viewers that that number has increased. Health MEC in KwaZulu-Natal Nomagugu Simelane Zulu confirming that there are new positive cases, because when they closed the hospital, they did not allow it to accept new patients following the confirmation of those 16 cases last week. But now, as of yesterday, there are new cases that have been confirmed in that hospital in KwaDukuza. They are consolidating the numbers, but they include medical staff, some minors, as well as some mothers of the babies that they had been admitted to that hospital. So she said it is likely going to be opened in the next 2 days or so, once they are satisfied that all precautionary measures have been taken. But coming to the other two private health institutions, that is the St. Augustine as well as the Kingsway Hospital in KwaZulu-Natal, they say they are satisfied now with the explanation and precautionary measures that have been put forward by the Nedcare Group. Those are some of the hospitals that caused a lot of stir and debate in KwaZulu-Natal. Some people saying they are accounting for a certain percentage of the cases. When it comes to eThekwini, if I'm not mistaken, there was a concern that one of the hospitals there contributed a certain percentage to the cases and deaths. But now the investigation is underway. It's not complete yet. It will be completed in due course.
Right, thank you very much. Siphamandla Goge coming to us there from KZN.